Good evening. Welcome to the In My Opinion show with host Ronald Berry Robinson and friends. Seen on the internet 24 hours, 7 days a week on popular sites such as YouTube and Facebook. The In My Opinion show is also seen on Comcast Cable Television Channel 17, Flint, Michigan, every Saturday at 6 p.m. and Wednesday at 8:30 p.m. The In My Opinion show is also seen on Comcast Television Channel 68 in Detroit. Check with your local listings and consult your community calendar. It is indeed a great pleasure to introduce Sonya Jackson, President of the Greater Flint Black Nurses Association. Welcome, Sonya.
Thanks, Denise, for having me.
Well, we're going to get right into this interview and talking with you. But first, I want the viewers to get a chance to know a little bit about Sonya Jackson.
Okay. Hello, everyone. My name is Sonya Jackson. I am the president of the Greater Flint Black Nurses Association. I am a registered nurse, RN BSN. A little bit about my history. I was a nursing assistant for 17 years, then an LPN, then an RN, then an RN BSN. And I continued down this path because taking care of people is very important to me. It's something I've always wanted to do. And when I decided to go back to school to obtain my BSN, I realized that would help me to open up other doors of opportunity.
How wonderful. Absolutely wonderful.
Thank you.
And you said you were working as a I heard 17 years, and I guess I want to go back to that to ask you, what was the transition that made you decide to go back to school?
While working as a nursing assistant, obviously I made less money, and just the security of being able to help take care of my family, and the education development to be able to further help other people, not just hands-on, but to get more involved in healthcare and in nursing in general. That was a long-time goal of mine.
Great, great. Now, are you a nurse in a general sense, or do you have a specific a group, like some nurses are oncology nurses or work with pediatrics? What is your specialty?
Okay, good that you asked that question. I am currently a float pool nurse, which means I float from unit to unit taking care of a vast array of patients. I work on medical surgical units, oncology, the burn unit, mother baby, med surg, orthopedic, just pretty much any unit in the hospital where there's a need. As a float nurse, we are actually additional staff. So when there's a need, then we report to the nursing office and they let us know where we're going to be working for the day. So every day is like a new adventure.
Wow. It sounds like it. It sounds like it. And it also sounds like you're well-rounded in terms of your experiences. That's awesome. That's awesome. Okay, well, let's talk about the Greater Flint Black Nurses Association. Now, I understand that you're the president, and that role has a lot of responsibilities. So tell us about that.
Okay. You're correct. As the president of the Greater Flint Black Nurses Association, I'm responsible for conducting monthly meetings. We meet every second Monday of the month. We usually have a speaker, so I need to, in advance contact a person that will be speaking for us to make sure that there is a place for them on our agenda. We have an agenda that we go by every month, and really it's just a time for us to get together as sisterhood and promote what we do, which is nursing and to decide what other activities we're going to do in the community for the upcoming months.
Okay. Now, with your organization, you were talking about doing some things in the community, but just tell me again, how long have you all been in existence?
Actually, I will give you a brief background.
Okay, that would be great. That would be really great.
In December of 1971, the National Black Nurses Association was founded by Dr. Lorraine Sands, PhD. And Dr. Sands was a black nurse who envisioned a system that would establish communication and the dialogue among black nurses. Because of her desire to know who they were and where they were and how they functioned, she was compelled to meet other black nurses from around the nation. It was after she attended a convention in Miami, Florida, that she decided that this was something that she wanted to do. So a small group of black nurses met at a home in Cleveland of Dr. Mary Harper, Cleveland, Ohio, to discuss the organization of the black nurses on a national level. And this was back in December of 1971. Locally, in September of 1976, the Michigan Black Nurses Association was organized.
Okay.
And then they were later disbanded. And in Flint, in 1979, another group was, came about. The Flint Professional Black Nurses Association was organized, and then they were later disbanded. So after several years without a formal voice for African American nurses in the Flint community, the Greater Flint Black Nurses organized. And it was later, back in May of 1989, that two of our founding members, Rose Luster and Edna Green Perry, went to Milwaukee for a national convention. And then they filed the documentation for a charter chapter. And it was in the following year of 1990 that the Greater Flint Black Nurses Association was formed and organized.
Wow.
And we've been in existence since then.
Okay, wonderful. Well, it's very interesting how you start, you stop, you start.
Right.
But yet ultimately, the vision of the organization was to support, I imagine you still are supporting nurses who, need that.
Right. Right.
Because it's just a lot to nursing. I know there is. About how many people are involved in your organization?
Right now we have at least 50 nurses. I'd say the roster does change, depending on, you have to at least have 12 members to even have a charter.
Okay.
So there is a, format that you have to have in place. And the main thing is that I really enjoy about the organization is that not only are we a part of the local level, but we're also affiliated with the national level.
Okay.
So we get national conferences. We have those annually every year, and it's rotated throughout the country. Okay, we also have our own monthly meetings where we get together and decide what we're going to do as a local chapter. But there is just a camaraderie of African American nurses, on a national and local level. And there's such a great need for that. And then just to have the support from the nurses all over the country and the networking opportunities, are just insurmountable.
Oh, I can imagine. But one of the things that's really interesting to me is when you have these conferences, nurses have been trained, but there's ongoing information that's, presented to them. Right. So tell me a little bit about that.
Well, just like to maintain your nursing license, you have to have at least 25 CEUs, continuing education units.
Sure.
And so that means that, maybe you got those units from attending a conference or going to workshops, different things of that nature. But the main thing is that nursing and medicine changes drastically all the time. And so to be able to provide the type of services that, patients need, we have to education, stay on top of things, make sure that we are abreast of the newest technology, the newest ways to practice. And so that's very important. Another reason why being in this organization is because if I attend a conference and I find out something new, then I can come back and I can report that information to my members. And that way I'm sharing my wealth of knowledge. And to go to these events and network with not only associate's degree nurses or even diploma nurses for that matter,
Okay.
but nurses that have gone on for a bachelor's, a master's, a PhD, a nurse practitioner. I mean, the accolades that these nurses have achieved are just, mind-boggling. Just to be in the presence of, a lot of these people that have gone on, you can see it motivates you to want to continue on with your education as well.
Absolutely. And when you think about the information that you may be bringing back, have you yourself or any of your members have presented at a conference on either a local or a national level?
We have had one member that has presented.
Okay.
We also have a member that is currently a PhD candidate.
Wonderful.
We also have members that are adjunct faculty to various colleges in the area.
Mm-hmm.
And it's just very important that we make our presence known in all areas, because if we have even the nursing students that we encourage to join our organization, they may look in the front of the class and say, hey, not only is she my instructor, but that's also, she's in our organization.
Right.
And so then, on a different level,
Mm-hmm.
that takes down a lot of that, fear and things like that students, experience going into college.
Right.
When they're more comfortable with their instructor.
Absolutely. With nursing, I know that there are clinicals that are involved. And so with having someone who's in front of them, speaking to them about that, I would imagine that would probably kind of allay some of their fears about what those clinicals are about. Mm-hmm. And with each program, is it different in terms of the clinical requirements?
It is. When I was a associate's degree nurse, I graduated from Mount Community College, mm-hmm. and we had 6 semesters of nursing clinicals. That's in addition to your prerequisites and getting into the nursing program. And we had to go 6 semesters of clinicals, and it was different, because a lot of times you may have been the only African American student in the group.
Okay.
There was definitely a limit, or so it appeared, to how many students were accepted each semester. Mm-hmm. So there may have been, 1 or 2 African American students in the clinical class, and the rest would be, either Caucasian or other, people. So it's very important to be able to look across the room and see someone that looks like you.
Absolutely.
I've also been adjunct faculty at my community college, where I teach nursing assistants. Mm-hmm. And in the past, I was a clinical teaching assistant through University of Michigan Flint.
Wonderful.
And through my community college. So that gave me a chance to see from the instructor perspective. Okay. And when I had a minority student in the class and they walked in and saw me, you could just see a little sigh of relief, because they felt comfortable. Mm-hmm. I do feel that as being the student and then being on the instructor end, that you don't have to use the fear factor. The goal is to make students feel comfortable so that they are ready to learn.
Absolutely. Mm-hmm. Absolutely. So with those experiences working with from the nursing side, actually in the hospital, and from the side of being a professor or adjunct, what's your take on either one of those?
Well, I definitely like the side that I'm on now.
Okay.
Just because the pressure is off, and I enjoy giving back. I enjoy those young minds, regardless of how old they are, mm-hmm. in years, just the mindset, because they're not nurses, and they're so eager to learn what I already know.
Right.
And then that also keeps me on task, because when they're learning, so am I. If there's something I don't know, I don't say, well, I know it and you try to figure it out. We learn it together.
Okay.
It's like, okay, just a minute, let's go and get the book, and, we're going to both learn it, because I don't claim to know everything.
Okay.
Nursing is just, it changes so much, there's no way that you could. Mm-hmm. And I think that once you're, just realistic, and, you just be like you are, mm-hmm. And you be approachable with the students, make them feel comfortable, but also, continue to stress the importance of how important it is to know what you're being taught. Because when a patient crashes, somebody goes down, you don't have time to get a textbook. You have to know it.
Absolutely.
You have to know it. Mm-hmm. That's the very important part that I like to stress to them.
Okay. And when you do that, and particularly again from the academic side, and you see the successes when the light comes on, I know that's got to make you feel good.
It does. I mean, just to see everyone, see the big picture. Like my nursing assistants, I'll teach them, the baselines that I require to complete the program, like what normal vital signs are. And then I go a little further. Okay, if the blood pressure is 90/40 and you come and report that to me, and Mrs. Smith has been 120/70, there's something different about that. We need to recheck it again. And I think once you go into detail and explain to them, to get them to understand the whole picture, that when they're measuring, intake and output, if Mr. Smith has not urinated in a whole shift and he's congestive heart failure and I've given him Lasix, I expect him to diurese. I expect him to be able to put out urine. So at the end of the shift, if he hasn't, then there's an issue. There's something that needs to be filed. I need to communicate that with the physician. And I think that once people start working together as a team and they see the whole picture, they understand their part in it, then it goes a lot better.
Absolutely. All right. Well, it sounds like you are very effective in your role.
I try to be.
Okay. Getting back to the organization now, about your chapter, are you the only professional chapter in this area?
I'm not sure about the only professional chapter. What I do know is that when going on different job interviews and doing other things in the community, once you get out there to start soliciting, for jobs and things, they want to know what professional organization you belong to. And it's very important to belong to a reputable organization.
Right.
To me, if you are a part of an organization that nobody knows about, then what good is your membership? If you're a part of an organization that nobody can ever reach you, what good is your membership?
Right.
So I think that your organization is as good as its members. And so you need to make sure that you're out there, that people know who you are, and that you make your presence known in the community. And I think that it'll be a lot more effective.
Okay, that makes sense. As I'm looking at you, I see that you have these different pins, and I wanted you to kind of give us some idea of what each one of those pins represent.
Okay, well, this top pin here is my pin when I graduated from Mott Community College back in 1999 with my associate's degree. And then this is my BSN pin from Ferris State University when I graduated in 2011. And then this is just a honors convocation pin because I graduated cum laude from Ferris State University.
Okay, wonderful.
Yeah.
Smart nurse.
Yeah.
Okay, great. Your purpose, you had mentioned it briefly as we started this conversation, but I want you to again to kind of give the audience an idea of your whole overall purpose of your group in terms of what you do for the nursing profession.
Like I said before, not only are we a part of a national organization, which I feel is really important to know, is because we have connections and committed nurses, African American nurses around the country. And I think that people should know and understand that because a lot of times patients come into the hospital and they may not see anyone that looks like them.
Right.
And being minorities in our organization, our goal is we want to help limit or decrease the amount of healthcare disparities. We understand that a lot of our people, African Americans, may be limited to the health care that they can access. Maybe it could be because of transportation. Maybe they don't live on the bus line and their doctor's appointment is across the way, and so therefore that's why they're not compliant. They don't have the funds maybe for a taxi, or they don't own an automobile. So it's hard for them to get there. So in that sense, they don't receive the health care that may be necessary for their disease process.
Okay.
We want to look at the whole picture. Why are African Americans not receiving the health care that they need? Why is there so much diabetes and hypertension and things of that nature in our community? Why are there so many liquor stores in our community and not grocery stores where they can buy fresh produce so that they don't have to be exposed to the foods that, contribute to their diabetes and their hypertension? And I think that it's very important that knowledge is the key. That's why we're out in the community, and that's why we're educating, on healthy eating, healthy lifestyles, alternatives, for our community members so that they can live longer. And I think that, with any disease prevention, education and prevention, is just the key. You have to get it before it takes effect. And then you can stop the snowball effect. If mom and grandma were all diabetics, doesn't mean that you have to be one. Are you predisposed to diabetes because of that?
Right.
Certainly, because some things genetically we can't help.
Right.
But there are things that you can do to decrease your chances of, being affected by that disease process.
Okay. And so with that, are the black nurses, are they involved with setting up programs in the community, doing workshops, doing some kind of initiatives? And if they are, tell me about those.
We are very involved in the community. There's several health fairs that go on throughout the year.
Okay.
You'll see us when you come. We wear our little vest. And we do a lot of screenings. We do a lot of blood pressure screenings. We do blood sugar screenings. And we do a lot of education. We have lots of literature on things that are strictly for minorities and people in general. Because all people get sick, not just black people, not just white people. All people, are at risk for diseases. Right. Our goal is to make sure that whoever attends that health fair walks away with some knowledge. There's several health fairs that we've attended where they actually have physicians on hand. Okay. So once we give them the results, then, if they're elevated, they can go and talk to the physician. And then the physician can explain to them what kind of changes they need to make or who they should follow up with. I do think that with all of the healthcare, costs that have been, cut and the benefits that have been reduced, that a lot of people are uninsured or underinsured.
Right.
And these could be working individuals. It could be me or you. I mean, just thank God today we have benefits, but who knows what we might have tomorrow.
Absolutely.
Tomorrow we may be looking for a free place to give out some health care. So, my mother used to always say you don't know where you're going, but you know where you're being. And that is true. Right. Because you just never know. So I do think that it's important to get the information out there to make sure that people take advantage of the free things that are available. I mean, there's so many resources in the community that are available, but if people don't know about them, then, it's kind of hard for them to be used.
Absolutely. And so in your organization, so that's one of your mantras, is that you do put that information out there to the public.
Yes.
You probably do some outreach to churches and to other organizations. Is there any interaction with other groups that you can talk about?
At one point, we were collaborating with the African American physicians, and we've done a couple of things, in the past with them. The main thing is that we like to make our presence known, even if we're invited. Different churches invite us when they're having health fairs. For a while, the churches have really gotten involved in community activities and promoting health care. And so, we get invitations all the time where they want our organization to come and do blood pressure screenings or blood sugar screenings. Okay. And we always have literature like we'll contact like the American Heart Association, the American Lung Association, and we'll have their literature on our table just to make sure that the information is, readily made available to the public.
Okay. And I was thinking, in terms of a person who may have like an elevated blood pressure or something that, really stands to need some immediate attention, and you happen to be working at one of these fairs, and you pass them on to the doctor. I mean, has there ever been a situation where someone had to be taken out by, like, say, an ambulance or anything like that?
Yes, we have had that happen, actually, and we have had, if the readings were elevated and there wasn't a physician, where the nurse has to explain to them what is normal. You'd be surprised the amount of people that don't know their numbers.
Wow.
Don't know what a normal blood pressure is. Okay. And just to give you an example, do you know what your hemoglobin A1C is?
Are you asking me that? Absolutely not.
Absolutely. Do you know what a hemoglobin A1C is?
No.
Okay. Hemoglobin A1C is indicative of diabetes. Okay, so when you go to your physician and you get your physical, they should be drawing a hemoglobin A1C. Okay, any number that's less than 7 is really good. Okay, I know my number is a 5.6. Okay, 5.6 is within normal. Okay, 6 is okay where they're going to start to get concerned, but 7, okay, somebody should have diagnosed me to be diabetic at that time.
Wow.
Do you know what your blood pressure is? What's the normal blood pressure?
120/80?
Actually, that has now been changed. just because 120 over 70 is like what we consider normal.
Okay.
By the time you reach like 130 over 80, they are considering you pre-hypertensive. Wow. Where it used to be 140 over 90. So they've lowered that number because more people were coming in thinking that they didn't have blood pressure, or thinking, oh, it's, 140 over 90, I'm okay, when really it's not. You're already pre-hypertensive. So I encourage people to ask your doctor questions. Don't just get your results and take them. Find out what your numbers are and what they mean. So that's what we do at health fairs. When we give them their results, whether we have a physician there or not, we write the results down for them, and we tell them to share those numbers with their primary doctor.
That is so helpful. That's so helpful. But listen, I wanted to ask you a couple of more quick questions in terms of your organization, fundraising and scholarships. Can we talk about that real briefly?
Sure. We host an annual scholarship fundraiser event, and this year our event is going to be May 4th. Of 2013. It's going to be at Stonegate Banquet Center in Davison.
Wonderful. And
you've attended that before. And
yes,
I'm sure you had a very nice time.
I did.
And that's what we like to do. We sell an ad, and this is just one of our ad books. You probably have this one.
Yes.
This was from our last event.
Right.
Where we had
it was a
back to the 70s. Event. Yeah. And so we sell ads and we sell tickets. Tickets are $35 a person. And that's how we raise our funds for our scholarships.
Great. Well, I am sure that people are going to be interested in learning more about your organization. So as we close, could you tell us how they can make contact with you?
I sure will. Our post office box, our address is GFBNA, Post Office Box 232, Flint, Michigan, 48501. And then our website is greaterflintbna@gmail.com. And that's how they can get in contact with us, and we will follow up with them to see if they're interested in membership or just want more information about our organization.
Wow. Well, Sonya, it has been such a pleasure talking with you. We could go on, but as you know, the show must come to a close.
Right.
We thank you so much for participation today. Sonya Jackson, who is the president of the Flint Area Black Nurses Association. This has been a stimulating and informative conversation. This has been the In My Opinion show, where your host has been Denise Smith-Allen. Have a good evening, and remember to stay focused.